Hello, how are you? It is always a pleasure to greet you and welcome you to a new video. This time we will talk about the following: Salmonellosis in dogs, symptoms and treatment. Let's see. Salmonellosis in dogs is an infectious disease of bacterial origin caused by bacteria of the genus Salmonella. Contracted through food, saliva or contact with the feces of an infected animal, it can cause serious health problems. It is transmitted between animals and humans. If you've ever wondered if Salmonella is transmitted from humans to dogs and vice versa, the answer is yes. Pathogenesis of Salmonellosis in dogs. Once the dog ingests the bacteria, it invades the mucosa of the small intestine, where it multiplies. This results in lesions in the intestinal epithelium and produces enterotoxins. Even though the immune system begins to attack the bacteria, Salmonella can take advantage of any weakness in the system to cause more damage. At this point, it lodges in the terminal ileum, the final part of the small intestine, where it multiplies, passes through the intestinal walls and causes serious damage. Once it reaches the large intestine, it exits through the rectum to contaminate more animals, thus continuing the fecal-oral cycle. 1. How do dogs get salmonellosis? Salmonellosis is most common in poultry, amphibians, and reptiles, but can also be seen in cattle, horses, and pigs. It is much less common in dogs and cats. It can be transmitted to dogs through food, water, and objects contaminated with fecal matter that contains the bacteria. Contact can be made orally and subsequent ingestion or direct contact with an affected animal. Raw meat and eggs are another possible source of infection. The bacteria can survive for months or even years in hot, humid places. Dogs with weaker immune systems are more prone to the disease, as are puppies or older dogs. 2. Symptoms of Salmonella in dogs. Most infected dogs are asymptomatic, but can still cause new infections. Some dogs may show some combination of the following clinical signs: diarrhea, sometimes bloody; vomiting; fever; anorexia; weight loss; lethargy; dehydration; miscarriages. It can cause septicemia or sudden death, especially in younger and older animals. Salmonellosis in puppies can produce a syndrome very similar to enteritis in dogs caused by canine parvovirus. 3. Diagnosis of Salmonellosis in dogs. Veterinary diagnosis of Salmonella in dogs can be done by stool culture. Can present as positive from the beginning of the infection, reaching maximum positivity in the 3rd week. It is very useful for post-treatment monitoring and for the detection of chronic carriers. Blood culture is performed on selective media and animals can test positive from the 1st week of infection. By the 3rd week, the positivity rate drops to 50%. PCR, a much more sensitive and fast technique than culture analysis. 4. Treatment of Salmonellosis in dogs. The use of antibiotics should be limited to cases of systemic disease, very severe cases or dogs with immunosuppression. The vet may prescribe one of the following antibiotics: ampicillin, neomycin, amoxicillin, sulfamethoxazole or trimethoprim, gentamicin, fluoroquinolones, chloramphenicol, 3rd-generation cephalosporins. However, as Salmonella is known for its antimicrobial resistance, an antibiogram should be performed and the most sensitive antibiotic administered. Many microbiologists do not recommend antibiotic treatment because it allows bacteria to remain in the gut after healing. This can affect the intestinal flora and make the strains resistant to antibiotics, which is why they are only used in the most severe cases, that is, when trying to save the life of the dog. If affected by salmonellosis, most dogs, especially healthy adult dogs, will have a mild form of the disease or will remain asymptomatic. In this way, the treatment will usually be carried out at home. Most importantly, good hydration and nutrition is essential. In cases of severe dehydration due to vomiting and diarrhea of the dog, it will be necessary to enter a veterinary hospital. 5. How to prevent salmonellosis in dogs. To prevent our dogs from contracting salmonella, it is necessary to avoid any possible source of the bacteria by maintaining good hygiene at home. Therefore, you should check that the environment in which you live is clean and disinfected. Avoid eating dirty or contaminated food and water. Avoid contact with feces of other animals or objects possibly contaminated with feces. Avoid eating raw meat that has not been previously frozen. If we touch lizards, birds or turtles, or visit a zoo, we must wash our hands before touching our dog. We must also prevent them from ingesting or having contact with these animals. Since it can be transmitted to people, we should always wash our hands after handling dog feces or objects contaminated with them. The same applies to any other potentially affected animal. It is also essential to cook food correctly, avoiding raw or undercooked foods, especially meat, eggs and unpasteurized milk. These foods are more likely to carry the bacteria, so it is especially important to control and treat them correctly. Develops your dog's hidden intelligence to eliminate bad behavior and create the obedient, well-behaved pet of your dreams. Hit the instant access button below right now and start your journey to having an amazing, obedient, highly intelligent dog today. Do not forget to subscribe to the channel, comment, and share the video. You are very well, thank you.